The title of this talk is Motor Cranial Nerve Embryology. These are the session objectives. You do not need to read them. They will be addressed in the course of this talk. This talk will be conducted using a question and answer format. The first question is, which of the following statements is not true? A. Rhombomeres means part of the hindbrain. B. The cerebellum arises from the first rhombomere. C. The motor nucleus of cranial nerve 5 arises from the fourth and fifth rhombomeres. D. The rhombomeres govern the formation of motor nuclei to cranial nerve 4, 5, 6, 7, 9, 10, 11, and 12, and the distribution of neural crest cells to the pharyngeal arches. I am showing you these photographs so you can see how rhombomeres look. Here you can see in a 3-day-old chick embryo the segmentation without any type of staining. Here, using neurofilament protein stain, you can see the segmentation much better. Each of these segments are called rhombomeres. The word rhombomeres comes from the joining of two words, rhombo, reflecting the embryonic region involved, the rhombencephalon, and the word meres, from the Greek word for parts. Each rhombomere has a specific combination of proteins which is different from the combination of proteins found in all other rhombomeres. As we will soon see, it is this combination of proteins that induces the formation of different brainstem structures. In a prior talk, we have seen this representation of the 28-day-old embryo. This is a slight different representation of the rostral region of an embryo the same age. But you can discern its similarity with the schematic representation of the 28-day-old embryo we have seen before. In this new schematic representation, you can see the rhombencephalon, mesencephalon, and the prosencephalon. I will now add the motor nerves going to the striated muscles to be able to correlate them with the pharyngeal or branchial arches. Notice that cranial nerve 5 motor neurons arise from rhombomeres 2 and 3, and they innervate the muscles derived from branchial arch 1. That the motor neurons for striated muscles of cranial nerve 7 arise from rhombomere 4 and 5 to innervate the muscles derived from the second branchial arch. That the motor fibers for striated muscle of cranial nerve 9 arise from rhombomeres 6 and 7 and go to innervate the stylopharyngeus muscle. This is the only muscle derived from the third branchial arch. Hence, this is a good fact to remember. Motor fibers for a striated muscle traveling with the vagus nerve arise from rhombomeres 7 and 8. Rhombomere 8 is not represented in this drawing. Fibers from rhombomeres 7 and 8 go to innervate muscles from the fourth branchial arch. Cranial nerve 11 is represented here. There is a debate as to the origin of the muscle cranial nerve 11 innervates. The debate centers on whether these muscles are somatic or branchial in origin. As you will see later on in this talk, we will discuss these muscles as being somatic, although there is evidence to support the branchial arch origin of them. Cranial nerve 12 innervates somatic muscles. The origin of cranial ganglia neurons can also be incorporated in this drawing. Cranial ganglia neurons originate from neural crest cells or from placodes. In this frame, I have dumped all of them. I have never seen a question in an exam about the rhombomere origin of a specific ganglia. The only important thing to know is that some ganglia arise from placodes, some from neural crest, and some from both. So the answer to this question is C. Next question. Extraocular muscles originate from the first branchial arch. A true, B false. This is a photograph of an about 40 days gestational age fetus, which I have illustrated here. Here you can see the nasal placode, and now I have introduced the optic placode. The otocyte or future optic placode and inner ear is now being introduced in this frame. I have now removed the external layer in most of the representation to illustrate internal structures. The cut corresponds to a partial sagittal dissection. In it, you can see represented the heart, diencephalon, telencephalon, mesencephalon, and rhomboencephalon. I have now added 4 occipital myotomes corresponding to the 4 occipital somites, and now cervical myotomes and their corresponding ganglions. Notice that no ganglion was represented corresponding to the C1 myotome. This is so because C1 has no sensory roots in most individuals. The structure I have added corresponds to the somatic mesenchyma from which the diaphragmatic muscles derives. I have now added the epichordal mesenchyma. The third cranial nerve arising from the anterior aspect of the mesencephalon, the fourth cranial nerve arising from the posterior aspect of the mesencephalon, and the sixth cranial nerve arising from the rhomboencephalon, specifically from the pons. As we can see indicated in this frame, the epichordal mesenchyma forms the extraocular muscles, including the levator palpebrae. So the answer to this question is B. Next question. Which of the following muscles arises from branchial arch 1 mesenchyma? A. Sternohyoid muscle, B. Omohyoid muscle, C. Geniohyoid muscle, D. Mylohyoid muscle. I will now introduce the last figure to add the branchial arch 1 mesenchyma and the trigeminal nerve. Notice that only the inferior or mandibular branch joins the mesenchyma. The muscles originating from the first branchial arch mesenchyma, those innervated by the mandibular branch of the trigeminal nerve, are the muscles of mastication. These muscles are the temporalis, pterygoids, masseters, the tensor veli palatini, that you can see here in aqua and here in a different illustration. This muscle is only seen from this angle if the levator veli palatini is removed. Other muscles arising from the first branchial arch are the mylohyoid and the anterior belly of the digastric muscle. In addition, also from the first branchial arch, we have the tensor tympani. Notice that all cranial muscles with the word tensor are innervated by the trigeminal nerve. So the answer to this question is D. Next question. Which of the following muscles does not arise from the branchial arch to mesenchyma? A. Muscles of expression. B. Platysma. C. Stylohyoid muscle. D. Anterior belly of the digastric muscle. Here I have reintroduced the illustration that I showed you in the last frame, and now added the second branchial arch mesenchyma here and here. I have now added the facial nerve. Muscles originating from the second branchial arch mesenchyma are the muscles of expression, platysma, the stapedius muscle, and the stylohyoid and the posterior belly of the digastric muscle. The answer is D. Next question. Which of the following muscles arises from branchial arch 3 mesenchyma? A. Sternohyoid muscle. B. Stylopharyngeal muscle. C. Geniohyoid muscle. D. Mylohyoid muscle. Here I have reintroduced the prior figure to add the third branchial arch mesenchyma and the glossopharyngeal nerve. Only one muscle derived from the third branchial arch mesenchyma, the stylopharyngeal muscle. So the answer to this question is B. Next question. Which of the following muscles arises from the fourth branchial arch? A. Cricothyroid muscle. B. Thyroarytenoid muscle. C. Cricoarytenoid muscle. D. Arytenoid muscles, transverse and oblique. As you can see, this is the last illustration. I have added the fourth branchial arch mesenchyma and the sixth branchial arch mesenchyma. Remember that branchial arch 5 involutes during development and does not contribute to the formation of adult structures. I have now introduced the vagus nerve and will go on to list the muscles derived from these branchial arches. From the fourth branchial arch we have, as you can see in this frame, the muscles of the uvula, levator veli palatini, and the palatopharyngeus muscle. In this frame you can also see the palatopharyngeus muscle, but also the palatoglossus muscle. In this frame, the pharyngeal contractors, and in this frame, the cricothyroid muscle. So the answer to this question is A. Next question. Which of the following muscles arises from the sixth branchial arch? A. The cricothyroid muscle. B. Palatopharyngeus muscle. C. Cricoarytenoid muscle, D. Palatoglossus muscle. From the sixth branchial arch mesenchyma, we have the laryngeal muscles, except for the cricothyroid muscle that originates from the fourth branchial arch. Please stop the video and read the name of the muscles in this frame. The thin brown muscle close to the vocal cord represents the vocal cord muscle. This is another view. Here, the right thyroid cartilage lamina has been removed, so you can see a good view of the larynx intrinsic muscles. So the answer to this question is C. Next question. Muscles innervated by cranial nerve 11 derive from A. Branchial arch 8, B. Occipital myotomes, C. Precordial mesoderm, D. Somatic mesenchyma. Here again I have introduced the last figure to add an island of cervical somatic mesenchyma and the accessory nerve. The bulbar component of the accessory nerve, which originates from the nucleus ambiguous, is not represented in this figure. The bulbar component joins the vagus nerve as both transverse the jugular foramen, and the fibers from the bulbar component of the accessory nerve innervates some of the intrinsic laryngeal muscles. So, as shown in this frame, from the island of cervical somatic mesenchyma arises the sternocleidomastoid muscle and the trapezius. The lower part of the trapezius is probably innervated by cervical derived nerves. So the answer to this question is D. Next question. Which of the following muscles is not innervated by the hypoglossal nerve? A. Styloglossus, B. Palatoglossus, C. Genioglossus, D. Ioglossus. This is the last illustration. Now I have added the occipital myotome and now the hypoglossal nerve. From the occipital myotome, constituted by somatic mesenchyma, derives all muscles with glossus in their name, except for the palatoglossus. These muscles, as well as all intrinsic tongue muscles, are derived from the occipital myotome and innervated by the hypoglossal nerve. So the answer to this question is B. Next question. Which of the following muscles is innervated by the first cervical nerve fibers via the hypoglossal nerve? A. Superior longitudinal tongue muscle, B. geniohydius muscle, C. Superior longitudinal tongue muscle, D. Vertical tongue muscle, E. Transverse tongue muscle. This is a representation of the hypoglossal nerve and the cervical plexus. Here we can see that C1 gets close and is joined by the hypoglossal nerve, and its fibers go on to innervate the geniohydius and the thyrohydius muscles. As you can see, both are innervated by C1 fibers that briefly join the hypoglossal nerve. So the answer to this question is B. Next question. Which of the following muscles originates from somatic mesenchyma? A. Ciliary muscle, B. Sphincter pupillae muscle, C. Dilator pupillae muscle, D. Stapedius muscle. This is a representation of the anterior ocular region. The ciliary muscle arises from mesenchyma and is innervated by parasympathetic fibers. The sympathetically innervated dilator of the pupil and the parasympathetically innervated sphincter of the pupil originate from optic cup neuroectoderm. The stapedius muscle, I hope you recognize this frame from earlier on during this talk, originates from the second branchial arch mesenchyma. So the answer to this question is A. Thank you very much for your attention.